Competency-Based Education, CBE, is an educational approach that focuses on learners demonstrating competency before progressing in their professional development. Competency refers to observable abilities of health professionals to perform successfully and efficiently. CBE is applicable to various health professions and offers accountability, flexibility, and learner-centeredness. It emphasizes standardized performance outcomes based on societal and patient needs, allowing for individualized learning and optimizing the preparation of health professionals. CBE requires a framework with a common language, standardized performance outcomes, and an assessment process. Different frameworks, such as domains of competence and entrustable professional activities, operationalize CBE and assess competence. The shift towards CBE in medicine was driven by the demand for patient safety and accountability. Similarly, in physical therapy, there is a need to establish defined performance outcomes and address instances where graduates are not adequately prepared for unsupervised practice. The current model lacks consistency and reliability in assessing learner performance, resulting in variable levels of proficiency among graduates. One challenge is ensuring that physical therapy students receive sufficient exposure to diverse clinical settings and patients across the lifespan. Anecdotal reports suggest that graduates may feel unprepared to work in certain settings, raising concerns about the effectiveness of current clinical exposure and experience in entry-level programs. This variation in performance can lead to suboptimal care and inconsistent standards. The current system also allows individuals to practice in any setting without demonstrating ongoing competence, leading to unwarranted variation in physical therapy skills and approaches to practice. As payment models shift towards performance-based reimbursement, the need for consistent, high-quality care becomes paramount. Competency-based training, where students must consistently demonstrate defined performance outcomes before program completion, can help address this issue and promote safer, higher-quality care. While further research is needed to fully assess the impact of CBE frameworks on learner and patient outcomes, preliminary studies indicate positive results. Customized learning pace, increased engagement, academic rigor, and improved patient outcomes have been reported in various healthcare contexts. By embracing a competency-based approach, physical therapy education can better ensure that graduates are proficient and ready to provide high-quality care across diverse practice settings, ultimately benefiting both learners and patients. CBE implementation in various professions, including physical therapy, faces several potential disadvantages and challenges. There is a lack of consensus on concrete and practical concepts related to CBE, necessitating a better understanding of how to effectively utilize this model. Further data is needed to demonstrate whether CBE improves the performance of physical therapists and patient outcomes. Implementing a CBE framework has financial implications, requiring training for students, clinical and academic faculty, database development, and the utilization of valid and reliable assessment methods. Accommodating students with different training stages and learning styles can be challenging for program directors and site coordinators of clinical education. The physical therapy profession has recognized the importance of a comprehensive, longitudinal approach to standardize performance-based learning outcomes. The PT profession has been exploring CBE since 2017 and convened stakeholders to determine the best framework for physical therapists. A hybrid approach, organizing competencies into domains and utilizing entrustable professional activities, EPAs, for workplace assessment, gained consensus. Lifelong learning is crucial but not well understood. The profession acknowledges the need for a continuum view of education, training, and practice, ensuring evidence of professional competence throughout a career. Building a competency-based curriculum involves identifying essential tasks for physical therapists across the learner continuum, mapping out where the necessary knowledge and skills are taught, and providing opportunities for practice and assessment in both simulated and clinical environments. To transition to a competency-based system of physical therapist education, the profession must prioritize establishing a common language, defining performance outcomes, and implementing a process to assess competence at different stages of professional development. Consensus must be achieved with input from stakeholders. The transformation will require commitment, accountability, and a philosophy that supports individual learning needs and ensures the highest quality of care for patients. It is acknowledged that this change will be challenging, requiring ongoing reflection and refinement. Extensive research is needed to demonstrate the benefits of competency-based medical education, CBME, in producing improved educational and clinical outcomes. This video is a presentation based on the article, Competency-Based Education and Practice in Physical Therapy. It's Time to Act, by Timmerberg et al., 2022, from the Physical Therapy Journal. If you're interested in exploring more videos on higher education, we encourage you to watch this video and subscribe to our channel. Thanks for watching.